Welcome back to part 3 of our PCOS series. In part 1, we looked at more about what PCOS is and its symptoms. In part 2, we started taking a look at some holistic approaches to managing PCOS. And in this video, we're looking at some additional holistic approaches to managing PCOS.
So we are moving on to optimizing gut health. So you might be eating everything, you might be having that nice balance, having those nutrients, being mindful of what you're intaking, but something's still not going right. Making all the lifestyle changes, where you might go a little bit further and find out, is there a reason you're having some low vitamins or mineral or something else?
They might take a deep dive into your history, whether it's your diet history, looking at fiber intake, take probiotic rich foods, as well as checking for any food intolerances. In my next video, I'll talk more about optimizing gut health.
Addressing sleep quality. Did you know that it's possible to sleep 8 hours and not have a restful sleep? Because while you want to meet your 7 to 8 hours of sleep, also have to think about the quality of it. Are you actually resting fully? When there's an illness, sometimes a lot of things can be worrying you. You may be asleep, but not really asleep because there's things just bothering you, right? That's one of the things. Also, PCOS itself can actually affect your sleep, where it's called something called sleep apnea, where you don't really breathe properly while you're sleeping. And so the doctors will check that as well to see if that could be affecting you too, and how can they optimize you to get better quality sleep. And we spoke about reducing the environmental toxins already. We spoke about alcohol and smoking. So limiting alcohol intake, if it's applicable to that patient where it's a little bit too much, then we might refer them to a program or talk to them about it. If it's a patient that smokes, quitting smoking does have a big impact on helping to improve a PCOS as well. Addressing the mind and emotional aspect of it, as I mentioned before, having an illness overall, like especially like PCOS, it goes beyond just the diagnosis, because everything what's going on, the hormonal imbalance and all things can actually cause depression and anxiety. It can cause negative self-thought about body imaging, the eating disorders as well. And so these are things that we look out for.
And so you may be referred to a specialist if necessary. Additional strategies can include regular exercises, yoga or Tai Chi, along with mindful breaks or micro breaks. These are short, intentional pauses that help to reset the mind and relax. These breaks can involve breathing exercises, stretches, or just moments of stillness. It's also important to recognize the positive impact of surrounding yourself with a supportive community, which can significantly enhance emotional well being and overall health in managing PCOS. Educating yourself about an illness like PCOS can be a powerful way to show support to a loved one. Those with PCOS can face many physical and emotional challenges, which can leave them feeling overwhelmed and isolated. So, by being informed, you can empathize more effectively and offer meaningful support that may help you to reduce their stress levels. Other ways to support them can include accompanying them to doctor's appointments, listening without judgment. Sometimes just being there to listen can be enough. Being patient and understanding. PCOS can be unpredictable and emotionally draining, so your patients can help ease their burden. Another is offering regular check-ins, just to let them know that you're thinking of them.
Now, those are mainly the lifestyle modifications that I mentioned there. What I'm going to do is mention adjunctive therapies, which is what can be used with lifestyle and medication. So, for example, I mentioned before, sometimes you can be eating the right amount of fruits and veggies, you could be eating the right amount of protein and everything, but you may still have some vitamin or minerals deficiency. And so your physician may decide to put you in a supplement for it. Very important that you don't start a supplement without talking to your doctor first, because the doctor has to check you out first to make sure you do need it. And they also want to make sure that it's not interacting with something else you're taking. So very, very crucial that this is discussed with your physician and you work along them. These are other supplements as well: coenzyme Q10, alpha lipoic acid, and Danqua,
and omega-3 fatty acids, which may help with reducing inflammation. Acupuncture is another adjunctive therapy that has shown to help alleviate symptoms experienced with PCOS. Acupuncture may help regulate hormone levels, promote ovulation, and reduce insulin resistance.
Well, that was a presentation in a nutshell, but as you can see, it is a multidisciplinary approach. It takes you have to think about different aspects of it. So it's like it goes beyond just the period issues or the fertility issues, and that's why you may be referred to several doctors as you go along. So just to put in a summary, polycystic ovarian syndrome is leading cause of infertility in women, affecting reproductive age, can cause hormonal imbalance and insulin resistance, which is the main cause of the signs and symptoms you see. management is really geared at regulating the hormones, achieving a healthy body weight, regulating bad periods, addressing the concerns, and managing any other conditions or symptoms.
And that's a wrap on our PCOS series. We did cover a lot, from what polycystic ovarian syndrome is, different factors that can play a role, and also we took a look at a holistic approach to management. Just remember, small changes add up, whether it's eating more whole foods, addressing any underlying nutrient deficiencies or health conditions, managing stress, prioritizing sleep, or just moving your body. Every step counts towards a better hormone balance. Over this three-part series, we did explore many different tips for holistic approach to PCOS. So keep in mind that not everyone will need all of these strategies. It's more about finding out the right combination that works for you. I encourage you to go back and rewatch the sections that stood out most to you. And if something resonates with you, discuss it with your doctor to help create the best plan that fits your particular needs. If you're watching this and you struggle with PCOS, or you're experiencing similar symptoms, I truly wish you all the best on your journey and I hope that you find the approach that works best for you. If this series gave you hope or helped you see things in a new light, please give this video a like. It not only supports the channel, but also help others in similar situations find this information. Those of you who have a loved one with PCOS, I hope this series has helped you better understand how to support them, because together you are stronger. You can also share this video with them. It might be just what they need to hear. This may be the end of the series, but there is still so much more to talk about. One key area that we did touch a little bit on but didn't dive too deep into was on optimizing your gut health, which is more than just digestion. See, your gut plays a major role in hormone balance, inflammation, metabolism, immune health, and even your mood. So in my next video, I'm talking about optimizing gut health. So make sure to subscribe and turn on the notifications so you don't miss it. Be well and stay safe. See you soon.